Hi everyone, my name is Dr. Uri Burstyn, and this is a young Dolly here, and we're here to talk to you about the top 3 signs that your dog might have arthritis. This is a very useful video for anybody with a dog, particularly a large breed dog like Dolly, because arthritis is definitely going to happen to your dog at some point in her life if they're lucky to live long enough. So before I go on too much further, I want to tell you exactly what I mean by arthritis. What I mean specifically when I talk about arthritis in this context is osteoarthritis or degenerative joint disease, which is the age-related variety. As many of you probably know, our bones have a coating of cartilage on the ends where they meet, the space called the joint. And that cartilage acts like a little lubricating coating on the ends of the bones that lets them glide past each other. Think of it like the Teflon coating on a frying pan. It's there to make everything smooth. And what happens with age and wear is that that coating can get chipped, can get eroded, it can get flaky and kind of dry, and in the end it can get worn away. And that process is degenerative joint disease, osteoarthritis, or just arthritis. And what happens when you have an erosion of this cartilaginous covering on the ends of the bones is bones start to grind on each other, which is very painful. And of course, just the process of erosion causes inflammation inside the joint, which is also painful and also reduces the mobility within the joint and reduces the sensitivity within the joint, all of which contributes to what we see with arthritis, which is joint pain, lameness, limping, stiffness, and just generalized discomfort. So that's what arthritis is in the context of kind of age-related degenerative joint changes that we're currently discussing. So what are the top 3 signs that your dog might be developing this condition? Well, the first one, pretty obvious, is limping or lameness. So if your dog starts to limp, you know what? Might have arthritis, might have about a million other things too, but should definitely get her checked out at the vet. But certainly favoring one leg or limping or lameness are a pretty common presenting sign. Often it's kind of subtle, often associated with exercise, like after a big day out in the park, and also often the day after a big day out in the park. So the day after exercise, if your dog's looking a little stiff or limping, that might be a sign that those joints aren't quite all right. The second sign that your dog might have arthritis, and this is actually the one that I really rely on and often ask my clients about in the history, is stiffness after waking up from a nap or in the morning after sleeping all night that goes away with a little bit of warming up and exercise. So this is really classical presenting sign of osteoarthritis in any species. So they'll be a little stiff, they might even be limping or lame or just maybe just moving a bit awkwardly when they're first waking up from a long rest. And then with a little exercise or after their walk, it goes away and it looks completely normal. That is a very, very reliable finding in arthritic dogs and should definitely kind of raise a red flag. And again, probably a good reason to reach out to your veterinarian because like all health conditions, you want to start managing arthritis early rather than waiting for it to get really, really bad and then trying to get on top of things. The third sign that your dog might be developing arthritis is exercise intolerance. That's a technical term for my dog's looking a little bit old, my dog's looking a little bit lazy, my dog doesn't want to go on walks the way they used to. Basically, a lot of the time when clients come and talk to a veterinarian and say, oh, I think my dog's getting old and doesn't want to play as much as they used to. That's actually just arthritis. And if you can manage it, the dog looks like a puppy again. And that's actually quite a common piece of feedback I get when I manage arthritis in my patients that, once we figure out what's wrong with them and give them the right medications, all of a sudden owners come back and they're like, oh, she looks like she's, like 2 years old once more. So that's really satisfying. So that kind of like reluctance to exercise, reluctance to play. And like the one sign that I often find comes up is when the dog just kind of quote unquote lazy, like doesn't want to go for a walk, turns around for a home. Whereas, when they were younger, they used to pull and like never wanted to turn around. Now they go to the end of the block, all of a sudden the dog wants to turn around and go home. Again, if you see that, very commonly it's arthritis. Of course, the other cause of exercise intolerance in dogs that's also very common is heart disease. So either way, you probably want to get her checked out at the vet. So if you see any of those 3 signs, think osteoarthritis, degenerative joint disease, or just arthritis of old age. And then when you do go to the vet, What your veterinarian should do is an orthopedic evaluation. An orthopedic evaluation or an orthopedic exam is when they test your dog's joints to see if any of the joints have reduced range of motion, if there's pain anywhere, swelling, thickening of the tissues. And the goal of that is to identify what you need to radiograph. Because ultimately, arthritis is a radiographic diagnosis. Now, we don't always have to do x-rays or radiographs to diagnose arthritis. Often it's pretty straightforward and pretty simple, and you can just look at a patient, get a bit of history, do a physical examination. You're like, yeah, it's an older dog showing all these signs, probably arthritic. However, and a radiographic exam is often indicated, particularly as sometimes your veterinarian needs to distinguish between simple arthritis and something a little bit more serious, like a ligament injury, bone cancer, things like that. So x-rays aren't always required to diagnose osteoarthritis, but I would really advise you to follow your veterinarian's judgment in that, because it is quite important to differentiate between arthritis and more serious conditions like ligament ruptures, ligament tears, bone cancer. All of those can actually present similar to osteoarthritis. And that's, again, why your vet should do a good orthopedic exam. And then based on that, say, yeah, this is arthritis, we probably should manage it. Or more likely, let's do some x-rays. Because really, a diagnosis of arthritis relies on very specific radiographic criteria, and the exam just tells you which joints to look at. So that's how you figure out if your dog has arthritis or not. Now, what do you do once you figure it out? Well, I have a video on managing osteoarthritis that I suggest you check it out. The link is going to be in the comments below. So I hope you found this video helpful. Thank you for watching. Please share, like, subscribe, all that good stuff. Check out the videos I have on this topic, and have a great day. Please remember to squish that subscribe button and hit the bell notification icon so we can see more of each other. And don't forget to like and subscribe and share this video with anybody you think might find it useful. And if you want to support our public education work, then please head over to Patreon, where your support is much appreciated. And I also offer second opinion cases if you need my help with your own pet's medical issues.